started practice of psychiatry a little over 30 years ago after finishing Vanderbilt's residency program. Had an outpatient practice, did inpatient work. Over the years it's evolved to where my inpatient work is exclusively about dementia now, but my outpatient practice has grown to be mostly about depression. Depression is a challenging illness to treat. It is something that people don't fully understand and oftentimes don't access treatment even when they are depressed. There are a number of different modalities, but none of them are effective in all instances. There are medications, there's psychotherapy, there's ECT, which has been around for 75 years. We haven't had a silver bullet for depression, and so it's finding that combination of things that helps somebody actually feel better and stay better. When I was following transcranial magnetic stimulation and its early research, Neurostar was the treatment that made that happen. It demonstrated research that was real, valid, and was quality. It demonstrated the efficacy, the durability of the treatment, as well as the safety of the treatment. It had done its homework to make it available to patients through insurance and the appropriate coding mechanisms, and mostly because once we started using it, we found that it did all of that. It worked, it was safe, effective, and durable. The initial treatment with TMS involves finding the appropriate spot to treat. Once we find the appropriate spot to treat and we find the amount of energy required to cause the stimulation, then we have a treatment which the protocol is 3,000 pulses each treatment with stimulation of the dorsolateral left prefrontal cortex. That lasts anywhere from 18 3/4 minutes to 37 1/2 minutes.
At best, my depression made me exhausted and very lethargic all the time. At worst, I didn't want to live anymore. So those were kind of two extremes that I've wrestled with for about 8 years. I was diagnosed with clinical depression when I was in 8th grade. I had tried pretty much every class of medication available. I had combined classes, tried different combinations of medications. I decided to try Neurostar TMS because I was at the point where I either needed to check into a hospital or find some alternate source of treatment, and there really is no treatment like Neurostar TMS. My Neurostar TMS experience consisted of going into a room that had a Neurostar TMS chair and a nurse technician who sat there with me for the full hour or so treatment. And there's absolutely no pain involved. It feels very strange at first, but it's not uncomfortable, but you honestly don't notice it after a while. My treatment lasted for 6 weeks. I came in every weekday for about an hour. What was amazing about the Neurostar TMS experience was that these electrical pulses are going directly into the area of the brain that it needs to get to. Neurostar TMS, there's no doubt or question whether it's getting there. If I had known this existed 8 years ago, I would have been the first person knocking on the door. I'm going on 2 years since my treatment, and I have not had any sort of relapse. I'm still getting better. I'm still finding more energy in myself and more drive in myself that I didn't even know was possible. That's what's truly amazing about this process is it's still working 2 years later.